Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Cynthia Cooper. She is a hospitalist and she wrote the Kevin MD article, "I'm grateful for your trust in me. I wish it didn't require a cancer diagnosis to win it." Cynthia, welcome to the show.
Thank you so much. I'm so happy to be here.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. My journey starts in Pittsburgh, Pennsylvania. So I grew up there. I'm the second of two daughters. I came up to Boston for Wellesley College for undergrad. I spent a little time in Chicago as a healthcare consultant and then came to Harvard Medical School for medical school and came to Mass General Hospital and have been there pretty much ever since. I'm actually trained as a nephrologist. I did a fellowship in nephrology and still love teaching about electrolytes and about kidney failure and so on, but have joined this academic hospitalist group and have really found a home among a group of wonderful educators.
So, like you said, you've been a hospitalist for the last few years now. Tell me about the evolution of the profession. What's changed over the last few years regarding hospital medicine?
You know, I think things that I've seen have changed. Well, definitely, my group hasn't changed as much. We've always been focused on the care and the patients that are on the academic services. There's definitely been an explosion of what it means to be a hospitalist in terms of having nurse practitioners and also having physician extenders as part of the group. I think that hospital medicine has become something that was an unknown profession to many clinician residents that were coming out of residency, say 15 years ago, to actually being not only just a wayward stop on the way to a fellowship, but something that can actually be a career and that people can find fellowship and scholarship and a real community within the hospitalist.
So I'm seeing advanced practice practitioners also in my hospital program increasingly be involved with hospitalist teams. So can you comment on that? Tell me how's that change or evolve the hospitalist care, the involvement of advanced practice practitioners?
Yeah, you know, and I'll say off right from the very beginning, I don't really work with them on myself. So my answer is somewhat limited because the kind of hospitalist that I am is an academic hospitalist that only deals with residents. So in many ways, the residents are sometimes my extenders in my practice as a hospitalist. But I do know that from those colleagues that I work with that they have found a sense of community with people who have come from different backgrounds in terms of the way that we take care of patients. But unfortunately, I'm not someone who actually works with those professionals myself.
And from working with residents all these years, have you noticed evolution or change in the medical residents that you've been working with over the years?
Oh, they're still the same bright, incredible people that they've always been. I think that I am incredibly lucky to work with some of the best residents in the whole country at Mass General. So as I said, again, their interest in me as a hospitalist in terms of my career path has definitely evolved over the years, and people are much more likely to want to become me than they were, say, 5-10 years ago.
Wonderful. So let's transition into the Kevin MD article that you wrote. It's titled,
Sure.
"I'm grateful for your trust in me. I wish it didn't require a cancer diagnosis to win it." Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Sure. So the story is one of this wonderful man that I met who was in terrible circumstances, 60-something years old, same age as my husband, who came into the hospital with evidence of having widespread cancer. Was in his abdomen, was in his thorax. It ended up being a cancer of unknown primary. One of the first things that happened when I walked into the room was he said to me, "I'm not getting a COVID vaccine," and was very, very, very much adamant that that was the case. And I spent a lot of time with him, sitting at his bedside, sort of listening to the different reasons why he didn't want to have a COVID vaccine. And it was interesting to me and somewhat shocking to me, the disparate pieces of information that were being pulled together as to why the COVID vaccine was somehow bad for him. It was ranging from President Biden being a bad president to the people coming over the border to scandals somehow related to Pfizer. I mean, it was so much propaganda that didn't make any sense to me. And what really ended up happening is just that time that I spent listening to him and showing to him how much I cared about him and how much I was concerned that if he did get COVID, that it would be the end of him at a time that he was facing this very serious life-threatening illness, made a difference to him. And what I remember most about him was he had been this successful salesman who had done very, very well in 2020. It had actually been one of the most successful years of his life. He had spent the whole year at his summer home. He hadn't had to go to any sort of family meetings that he didn't want to. So his perception of what 2020 was like was so different than what mine was like, where it was one of death and illness and terror. And when I finally convinced him that he should get the COVID vaccine, he said to me, "You know what? You have to learn the first rule of sales, Dr. Cooper." And I was like, "Well, what's that?" He said, "Well, once you've sealed the deal, you need to shut up and get out of the room." And I took that to heart and did, and immediately left the room. And we went and got a Moderna vaccine, and he was accepting of it. And then later on, let me know when he got his second vaccine, and continues to this day to let me know how he's doing.
So when you talk to patients who are unvaccinated in a hospital, what's your general approach?
Sure. For me, it showed how the importance of listening to patients, kind of meeting them where they are, finding a sense of connection with them. I mean, we connected over multiple different things, including our families, over our relationships. And that connection is what allowed me to get to the place where he actually could make the right decision for himself.
Do you think with that particular patient, you told him your story, was there anything specific that you said that resonated with him that made him eventually get the Moderna vaccine?
I think it was just that it was clear to him how much I cared about him. I came and visited him every day, and we would talk about not just the vaccine, of course, and not just his cancer diagnosis, but talk about his business and how he had dropped out of high school and had dropped out of college and had started his own business. And I really got to know him as a person. And I think it was that curiosity that I had about him that made him feel a sense of trust in me, and that I really was looking out for his best interests.
I think it's important to share success stories like these because there's a perception, especially when I talk to other physicians on this podcast and physicians write on my blog, that once people decide not to get the COVID vaccine, it is very difficult to persuade them. So I think it's important to share stories where physicians are successful in convincing patients. In general, in the hospital, how often are you successful in getting patients to change their minds about the vaccines?
You know, I think that being in the hospital is actually is a very critical moment, that people are facing their mortality as acutely as my patient was, or patients who are somewhat less sick. But I think there's always that opportunity to be able to have a human connection in which they feel that you, their doctor, Dr. Cooper, specifically care about them and are wanting them to make the right decision. And I think that the more time that we're able to make those connections, the more successful we'll be.
For those hospitalized patients with COVID in a hospital, of course, the majority of them tend to be unvaccinated. Do you sense any regret from these patients when you talk to them about not getting the vaccine?
I have had patients who have expressed regret about not getting the vaccine. Absolutely. I've been off service now for the last couple of weeks. I'm going back on service on Wednesday. My expectation is the percentage of patients that I'm going to see in the hospital who are sick with COVID, who are unvaccinated, that's going to be something that they are going to express as a sense of regret. I've heard many times from colleagues of mine talking about patients who say that they just never realized that it could be so bad, that they could be so ill.
We're talking to Cynthia Cooper. She is a hospitalist, and she wrote the Kevin MD article. I'm grateful for your trust in me. I wish it didn't require a cancer diagnosis to win it. Cynthia, what kind of tips and advice can you give to other physicians in terms of talking to patients, in terms of convincing them to get the vaccine? And when you say that you want to sit down and get to know patients, give some examples about what are some of the things that you say in order to build that connection with patients to better convince them, hopefully, to get the vaccine.
Well, I mean, not even just about getting the vaccine. I mean, one of my biggest things for any patient is trying to get to know them as a person as best as I possibly can. And you made a point of saying sitting down, and I think that that's one thing that is incredibly important to any sort of connection, is finding a way of showing that you are slowing down, that you're wanting to spend time, that you actually care about who this person was before they came into the hospital. A passion project of mine, which is a bit of a different from your question, is trying to get patients and their families to bring photos of what the patients look like before they came into the hospital as a way of better sort of being able to have a connection between who they were before they came and are dressed in a Johnny and are so sick and are so nondescript from all the other patients that are in the hospital, to be able to see them with their family, to be able to see them with their loved ones, I think makes a big difference. And I think just asking that question, to be able to see photos of someone before they got ill, is one way that I build a bridge with the patients that I take care of.
So by the time this podcast publishes, we're going to be in the midst of the Omicron variant. Yeah. Now, for those podcast listeners who are listening to you and they're on the fence about getting the vaccine, can you paint a picture of what it's like to be in the hospital
Oh God, it's the worst thing. It's the worst thing. You are in a room by yourself. You are isolated away. Everyone who comes into you is fully gowned, is fully masked, is fully geared, and so on. You feel horrible. As far as I can tell, the patients who have COVID, there's a sense of a cough that just will never quit, a sense of breathlessness that never gets any better, a sense of restlessness in terms of not being able to sleep or find a comfortable position. And in that setting also too, you are both afraid and lonely, and you can't see your family members because no one can come in and see you. I think that that COVID is one of the most depersonalizing, dehumanizing illnesses that we have, and it must be incredibly frightening for anybody who has it to be sick in the hospital with this illness.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Take-home messages. Well, of course, always listen to your patients, sit down, find a way of finding a human connection with them the best way that you possibly can, and enjoy the privilege that you have of being a physician in a hospital, taking care of patients that sometimes you would never have met in a million years in your life, that those patients get a chance to sort of become part of your life story and you become a part of theirs. It's an incredible privilege.
Cynthia, thank you so much for sharing your time and insight. And thanks again for being on the show.
Sure. Thank you so much for having me. I appreciate it.